that it is possible in this country of ours to build a society in which there will be full employment, in which there will be a higher standard of living, in which there will be an improved quality of life, while at the same time maintaining a reasonable stability in the cost of living.
Saskatchewan is a very sparsely distributed province, and so you have lots of people scattered throughout.
Saskatchewan historically has had to rely on things like crown corporations and public services because the private sector just wasn't willing or able to invest in the province to the extent we needed.
The beginnings of public health care in Saskatchewan go back long before the infamous 1962 doctors' strike. But ultimately, things came down to a publicly funded universal system that anybody can access when they need it, not based on whether they can afford to pay at the time.
We have in Canada the resources and the industrious people who could make this a great land dedicated to meeting human needs and responding to human wants.
Governments have historically always used tight times, austerity, as a justification for privatization. The Sask Party doesn't want to be associated with privatization. That being said, the Saskatchewan Party has embarked on, I think, a decades-long privatization initiative, mainly under the radar. You've seen the outright sale of publicly owned corporations. We've seen the contracting out of previously public services. And then we've seen the use of P3s extensively by both the Brad Wall government and the Scott Moe government. Effectively, a P3 is a rent-to-own scheme. The private sector offers to build, operate, and maintain these assets in exchange for the government giving them annual payments year over year for what can be 30 years. It's usually a bundled contract. It's meaning it's not a contract to build one school, it's a contract to build multiple schools. And so in order to save money, the private consortium will often use a standard design. And so as we saw in Saskatchewan, you had schools that immediately needed portables because the student population was a lot larger than what they had anticipated. You need a consortium, and these are multi-million, sometimes billion-dollar contracts. That's why you see usually it's multinational consortia from out of country, out of province.
Saskatchewan Hospital opened 3 years ago. If we're going to spend huge dollars on construction companies to do this, why wouldn't we give it to the companies that we have here in Saskatchewan? The entire roof had to be replaced. They had leaks throughout the facility that certainly wrecked interiors. For probably a year and a half, they were bringing in bottled water to the entire facility. There were water mains that broke, flooding mass areas of the facility, sewage backups at different points.
know that when we contract out a public service to the private sector, workers get paid less. They're usually put in more precarious conditions. They have less benefits. This, in turn, creates low morale, high turnover, less expertise, right? That results in lower service quality.
We have very limited healthcare personnel. So if we have a parallel private system that siphons those healthcare personnel off, for the few people that access the private system, their wait times may be shorter, but actually what the evidence shows is that for most of us in the public system, it actually further increases wait lists.
When they privatized surgery, they started doing it way back. We saw a lot of patients coming back with post-infection, so therefore that created a significant amount of workload in our department. I can attest to that because I was a tech in nuclear medicine department. So you can privatize all you want, but there has to be a capacity in the public system for after you privatize for people to come back here.
I think what the pandemic sort of laid bare was the effects of privatization and contracting out on our health system. Initiatives like Lean, which was supposed to create all these efficiencies, at the end of the day removed a lot of redundancies, which were considered excess, considered fat. You know, we need some of that excess capacity. We need some of those redundancies in the world we're going into.
Over the last few decades, we've seen increasing cuts to funding of the public system, and that has been used to justify privatizing.
There has been a deliberate effort, in my opinion, not to have the baseline staffing in this public system. These are serious things that we need help with.
People are getting worn out, we're tired. We wish we had more staff so that we could take a break and a breather, because we want to try and give our residents the best care possible, but when you don't have enough staff to help out, give them what they need, it's kind of a stressful situation for the people on the team.
And of course, then you have a COVID disaster where staff are sick and patients are sick and the care needs are higher and the people there to fill them are gone. And what does it lead to? Terrible mortality.
And so I really would like to see increased public investment in our public health system so that it can be a public health system that is ready for the future of healthcare.
The Saskatchewan Transportation Company was a 70-year-old bus company, and it served people in really rural communities. So it was like this lifeline that everyone could depend on to access key services that exist within urban areas.
You know, STC was really a model for the world. Everything with STC was measured by accessibility, affordability, and safety.
2017, the government had gutted the STC completely as part of its budget. But it did say, as part of the decision, that it would open up space for private sector companies.
There were all these companies that came forward and were going to take over all these routes. Well, it wasn't long before only the profitable routes kept going. The other ones are cut. The market looks for profit, and private agencies look for profit. So if there is no profit, they're not going to be serving those areas.
It took, I think, until 2019 for an activist to actually sue one of the private sector companies because they didn't have wheelchair accessible buses.
The disability community was so up in arms. Like, what are you doing to my life? People with disabilities couldn't get out to visit their families outside of Regina. They're just prisoners in their own homes, basically. Like, if I wanted to go to L'Orange, I would definitely take the bus. There's nothing now. I don't go. I have a sister there and I want to visit her and I can't.
We called for a social audit to know the actual cost of cutting a service like STC, because we know that people being able to see elderly family traveling urban, rural, or when you hear stories of kids that are in social services not being able to access a different parent. When you're dividing families, what's the social cost of doing that?
There's a lot of data that shows that care in a privatized parallel system is probably not as good as in the public system, because they're in this to make profit. And long-term care is a classic example. You only make profit by cutting corners in care.
I'm a special care aide. We're not blood family, but we're family because we see them daily. We know them like the back of our hands. We know their needs. Since I've worked in both public and private care home, I feel that the public is more team-orientated. I feel that you're supported more. Public is more safety-orientated because we have OH&S, we have safety standards, we have regulations, things that we have to abide by to make sure that the safety of the people is #1 priority. Whereas if it's private, they don't have those high standards or qualifications. So basically anything can happen in private care and there might not be any repercussions or anyone held accountable for the things that are happening. In my opinion, when you're charging one person $5,000 minimum a month to live in a 1-bedroom with minimum care, minimum food, nothing special, like no special outings, nothing like that, who's the one that's benefiting here? Is it the owner of the care home, or is it the person that's paying the $5,000 that their needs aren't being met properly and that they should be getting more for their money?
I mean, medicine is full of decisions to be made about what's good care, what isn't, who needs what, whether they'll benefit from it. And if you introduce a market profit motive into that, I think you start to get not necessarily good decisions about what care is provided. I mean, you just need to look at the States to see that the costs are much higher in that privatized system and the outcomes are worse.
If we look at cost effectiveness, it is cheaper to do things in the public system. There was a research in the BC talking about how it is 2 to 3 times more expensive to even do basic knee surgery in the private system than what you see in the public system.
The public line at the time was that it would be better for the government, but the dollars from our perspective as local people appeared to be huge. Saskatchewan Hospital has a maintenance contract that is around $4.5 million a year. But that is equal to what was spent in the entire Northwest here prior to the build.
There's an entire movement called the remunicipalization movement that has been experienced all around the world, where previously privatized services and assets have been brought back into public control. And the two biggest complaints as to why they want to return them to public control is lack of cost savings and lack of quality services. So the two sort of pillars of what privatization was supposed to deliver, right, cost savings and increased quality, just has proven not to come about.
A Crown corporation is not motivated by profit. It's actually about service to people. It's about equity. It's about creating the sort of society in which everybody can enjoy human dignity.
We need to have rules, regulations, programs put in place that cement the crowns.
What we need to do is think about public services that actually give people an equal playing field for starters and an opportunity to become fully democratic participants in society.
The successful part of Medicare was achieved by quite a vociferous political battle. Tremendous contributions made by ordinary people on the ground, and we need to defend it that way as well. This current government has absolutely no respect for science, for evidence, for public health.
A lot of this is in the bones of the Sask Party, right? Like they really have an aversion to government offering things that they think the private sector can do.
Get rid of the Sask Party.
I think of the men and women who believed devoutly that it was possible to have a more humane and a more just society, and who gave of their time and their money and their energy to begin building it. The men and women organizing, raising money, who canvassed from door to door, who passed out literature, who manned the polls, who drove cars on election day. You who are here and thousands whom you represent, these are the men and women to whom we should be profoundly grateful.